My son Mason, who is 9, is at the Gold Coast University Hospital because he's been diagnosed with Perthes Disease about a month ago. So he started limping and having pain in his hip. We were seeing Dr. Annabelle Stabler for basically making a plan.
Perthes is a condition that affects children's hips. For some reason, we don't know why, there can be a problem with the blood supply to the ball of the hip joint. The head flattens and can cause early arthritis. This means that some kids will go on to have an early hip replacement, so it's a really big problem.
It can last anywhere from 18 months to 5 years. It usually affects kids in between 3 and 11.
Mason came to see us in orthopaedics. We caught this really early, which is fantastic. We were able to get in and do surgery for him really quickly and to put that head in a better position, and hopefully we can stop the collapse and give him a really good outcome. Perthes tends to affect around 1 in 10,000 kids. So it's not really common, but we have a really big catchment area. As a result, I do see quite a lot of kids, and I think I've got about 20 kids under my care for Perthes at the moment. Mason
is very active. As a family, we're just trying to compensate for the things that he can't do. So if he can't do anything physical, we make sure we, do fishing, we go to the movies, we see friends, we go to time zone and things that he can participate in. Post-op recovery is basically the bone will have to hit fragmentation stage and the body will get rid of the bone, and then the body grows a new bone. It can take up to years. That could mean physical restrictions for the next 18 months, 2 years, 3, 5 years. Most likely will require a wheelchair most of the time, just while the disease is running its course basically.
If we can intervene early with these kids and start them non-weight bearing, so that means keeping the weight off the leg, or for some kids early surgery, that can shorten the time that the head collapses and give us a better outcome long term. These kids have a limp, they might have pain down the thigh, so not actually at the hip at all, and they look really well. So if your child is limping, that's not normal, and please see a doctor. The steps then would be to get an X-ray, and sometimes kids will need an MRI, and it's great to see the orthopaedic surgeons.
We'll get on top of it and his body will heal itself.
So if as a parent you've got concerns, trust your gut and get your kid to the doctor.